Morning, morning, morning. Good morning. Good morning to you.
And we're back. We're going to be heading over now to the folks at Martindale's Road, the Queen Elizabeth Hospital. Joining us this morning, Dr. Dale Springer, the Consultant General Breast Surgeon at the QEH and a lecturer in general surgery at the UWI Cave Hill campus. We're also going to be talking to my former colleague and still friend, communications specialist, Shane Seeley. Good morning to you both.
Hi, good morning.
Good morning, Wendy. Season's greetings.
Season's greetings to you both. Now, I understand that someone who does not want to be known has decided to drop a huge gift
Indeed.
at the chimney of the QEH.
Well, $450,000+ we received recently in the form of a donation, yes, from an anonymous donor. They wanted to remain that way, and it's one of the many donations that has been coming in to the QEH over the past few months and over several years, really. Our philanthropy department, through our philanthropy officer, Gay Howell, of course, our Director of Medical Services, Mr. Anthony Harris, and also our Chief Operations Officer, Dr. Christine Greenwich. They were the ones who spearheaded and made sure, along with Dr. Springer, made sure that we received that money, which will go to purchase some very, very critical equipment to enhance the level of care we are offering, especially in Dr. Springer's department at the QH. It's no small feat, and we are really thankful for that donation. Dr. Springer, as I said, we'll be spending that money on some equipment for his department, and I'm telling you, we need it because of some startling statistics that Dr. Springer will be sharing as far as breast cancer and how it's affecting our Barbadian women and men as well, because breast cancer affects men too.
Let's throw to you now, Dr. Springer, in terms of these monies and the equipment that you do need, because we're always talking about breast screening, but the cost of breast cancer can be quite exorbitant and daunting for individuals who are diagnosed.
Yes, the cost of treatment can be expensive, but let me first say, before I go any further, we also like to thank the donor who has made this substantial donation. And as I committed at the acceptance ceremony, we will definitely use it well to the benefit of all of our patients.
Okay.
Yeah.
And how many would you, offhand, can you remember that you actually have on roll now in terms of the breast checks and people coming back for follow-ups, that this equipment is likely to help? Because Shane spoke about the startling statistics.
Right, so we at the hospital actually see majority of persons who are diagnosed with cancer. In the primary care, they will do the checks. In terms of the exact number we have, I can't tell you, but in my clinic, I see 3 or 4 patients with breast cancer almost every week. Yes, and in our terms of our statistics, nationally, we diagnose in excess of 150, close to 200 cases of breast cancer. It's the second leading cause of cancer in our population after prostate cancer. And then overall, looking at the worldwide statistics, we actually in Barbados have the highest mortality for breast cancer in the world. So if you're diagnosed with breast cancer, you're more likely to die from breast cancer if you're diagnosed in Barbados than any other country in the world. And that is something that we're not proud of, and that is something that we are working gradually to change. And
Well,
this
I'm
equipment.
glad that's what I want you to tell me now, exactly what pieces of equipment are likely to be purchased that are definitely needed at the hospital, and how that can help to stem the mortality cycle.
Right. So one of the first pieces of equipment we are hoping to get is a Geiger counter. This is an instrument that is used to detect the sentinel lymph node, and that's the first node that breast cancer was spread to. Yes, and by doing this here, it allows us to detect it more accurately and also in a quicker fashion, so we can do more precise surgery. So that's the Geiger counter. Right. The other instrument we are hoping to get is a specimen X-ray cabinet, because sometimes we have to put in markers for patients who have lesions that we cannot feel, etc. So when we take it out, we want to confirm that we've actually gone the right lesion, and we have also have clear margins that we've taken out everything and we've not left out a piece of it. So this X-ray cabinet will help us to do this.
Okay, so it's mainly those 2 pieces, or there are a number of other
Right, so those are the
machines you
2
might
pieces
need?
that we are more or less committed to purchasing, but there are other equipment that we want to get. There is a a radar to detect something called a savvy scout that helps us to also do biopsies and localize cancers and lymph nodes.
Right,
that
because
we
I was
cannot
going
feel.
to ask about that.
Yes.
Whether or not you have the capacity now to do the necessary biopsies, or if individuals have to go out privately and then come back for the
So
surgeries.
some of the biopsies we do in-house, but some are done outside the hospital. We're trying to get to a situation where we can do all in-house. In terms of getting this device, it will also help us to get away from using wires. So for lesions that we cannot feel, or lymph nodes and so forth, some things that we cannot feel, we have to use a wire to localize them, to locate them, and then take the patient to surgery. And the wire is not placed in a hospital, it's placed outside. So this third piece of equipment here will actually allow us to localize it in hospital, and the patient will not have a wire sticking out the breast, and then they'll come straight to the data. So it's a neater way, it's a more efficient way,
Okay.
and the detector can stay up to a year without causing any harm to the patient. So sometimes we need to give patients therapy, chemotherapy, and so on before the surgery, so they have the detector in, and then when they go back to have the surgery, we can detect the area that was of concern in the beginning.
Okay, but for an entire year.
Yes, it's what it's called inert.
It's non-invasive.
Yeah,
Okay, okay.
right.
Okay.
But the year is the maximum time, but most times the therapy could finish within 6 months, and it would cause no harm to the patient. And this is the most important thing.
Okay.
Make it-
Now, Shane, in terms of these donations and your philanthropy department, you said you've been receiving funding all year, and you have individuals who are targeting donors and donations. In terms of the spend so far, or in terms of the cumulative figure, could you tell me what in 2023 the hospital would have possibly seen?
Yeah, philanthropy officer Gay Howell, she has been very, very busy reaching out to a number of players, not only here in Barbados, but across the diaspora, especially in the US. They have been very kind to us. They have committed some 200,000 Barbados dollars in terms of donation of equipment. Generally, the overall spend we expect by the end of the financial year, this is the projection. Right now, we are over $2 million, 2 million Barbados dollars. And by the end of the financial year, March, April, going into the new one, we should be reaching that $3 million target. So we're in excess of that. The $450,000+ has really significantly helped to boost that. But we've seen a number of donations. Biba Charity, you may remember early in the year, they would have donated to the dialysis unit. We've seen smaller donations as well coming from the Cancer Society, but no donation. We don't measure the size.
Yes.
Every donation coming to the hospital
And you
is
would have
critical.
also had some patient care equipment when the Barbadians living in Miami and
Exactly.
yes, would have done so and so forth. So.
Yes, and the consulate there, of course, Ambassador Rudy Grant leading the charge there. They're in constant communication with Ms. Howell, and soon they will be on another mission to get some more equipment and some more funding from the diaspora as well. And it's great to see the level of support that we are getting there, but we're not staying in the hospital and waiting for it to come. Gay, she's reaching out to our partners there, and we should see a lot more traction going into the new year. And the new year is our 60th. I know CBC,
Okay.
and
Yes,
of
we
course,
just had ours.
again, happy birthday, CBC. I didn't get to do my official tribute, so
Okay.
I'll get the opportunity to do that now.
You can do it now.
Happy
We'll
birthday,
accept.
CBC, of course, on the major milestone, which is the 60th, and the Queen Elizabeth Hospital following closely behind as we celebrate our diamond anniversary next year
Yes.
as well. So I'm telling you, we'll be seeing some more donations, especially and over this Christmas period. We've seen a number of people just showing goodwill from schools. St. Michael's School was the most recent one. And you go to our Instagram page at QEH Connect, and you'll see the number of people just having that goodwill at this time of year to donate.
And I'm
but
sure,
it's good that
and
it
I'm
extends
sure we're going
beyond
to
that.
have the carolers and the whole lot of it in on the children's ward and coming through with some of the other wards to bring that Christmas cheer. Now, I want to get back to you, Dr. Springer, in terms of the equipment. And you'd mentioned that men have breast cancer too. Is this equipment going to be useful for both, or do you have to have some specialized equipment for males?
This equipment can be used for both males and females. Yes.
Okay. Now, what percentage would you say we have of men in Barbados having breast cancer?
It's going to be a little less than 1%. In the international literature states for every 100 women that develop breast cancer, we will have one man. So we see about that.
Okay.
Yeah.
Now, coming into 2024, or in terms of getting this equipment, do you have any projections as to when you could possibly start to see a leveling out in terms of the care that is meted out and bringing those numbers down?
Well, it's going to be a process over time, I think. It's not as simple that you're going to see in a year or two, but I think over time. But what is important, we have noticed it, we have taken note of it, so we are working comprehensively as a team because it's not just surgery. So the surgeons who are involved, the radiologists, the oncologists, the radiotherapists, all of us are working towards the goal of trying to improve the care. So I think over time, we will see some improvement. We have actually restarted our multidisciplinary team meetings. So the first Wednesday of each month, we have a meeting dedicated to discussing all of the cases of breast cancer, the complicated ones that can go on for 3-4 hours with all the specialties. Yeah. Then I'm aware that they're also working to get some equipment for the radiotherapy department as well. I think Shane will speak a little bit about that. So we are
Okay.
taking note of it, and we will expect to see in the future, hopefully the intermediate future, an improvement in these statistics. And this will redound to the benefit of Barbadian women.
And can you repeat those statistics again for our women out there so that, we can take a little bit more care and caution when it comes to breast health?
So the most concerning one is the fact that in Barbados, we have the highest mortality for breast cancer in the world. That's the most concerning one to me. The other thing is that we see that breast cancer is the second most common cancer in Barbados, second only to prostate cancer. And what we are seeing also is that younger women are being diagnosed, persons under 40, and they tend to have more aggressive disease as well.
I'm glad you mentioned that it's more aggressive there because I know of 1 or 2 cases personally which within, say, a matter of months degenerated significantly. And it was along the way they were trying to get assistance, get care, but somehow, somewhere along that chain, there was a fall through. What should really be the steps that we as women and men take to ensure that there's complete follow through?
I think it starts with prevention. So both women and also men should be aware of their breasts, examine their breasts at least once a month, and if there's any concern, any lumps, any discharge, any concern, to seek medical attention right away. Anything is new, don't say it will get better, I'm going to wait for 2 weeks, and then that 2 weeks turns into 4 weeks. So seek help right away. And then once you're seeing, the relevant investigations will be done, and then biopsies, and then you'll be referred along the pathway. And you usually will start by seeing the surgeon or the oncologist, and then the treatment will ensue.
Can a biopsy be done at the QEH now? Or-
Yes, it can be done.
Okay. Now, you'd mentioned Shane and this radiology department. How are you looking to beef that up?
More funding, more donor funding, and of course more funding which would come out of the CapEx budget specifically for radiology and providing equipment there. But there is a bigger story, Wendy. We were really appealing across the board because corporate Barbados has been good to us. They continue to be good to us. A number of them are our vendors. We're appealing for more donations of that kind. We want to see more money coming in because it's one thing, government, of course, they would have allotted a sum of money for the Queen Elizabeth Hospital.
Yes.
But I can tell you it is not enough. And that's why we depend also heavily on these donations coming into the QEH to support the CapEx budget so that we can get the necessary equipment like for Dr. Springer's, for AKU, etc.
I'll put the QEH on my Christmas wish list and my
I love that.
2024 things that I want to see. I want to thank you so much, Shane Seeley and Dr. Dale Springer, for joining us here on Morning Barbados to
Thank
talk
you.
about this program.
And season's greetings, all the best.
Season's greetings to you both as well.
Morning, morning, morning. Good morning.